Billions of dollars have been poured in longevity research businesses over the last 10 years, and commercials for goods or diets promising to cure or avoid the symptoms of aging are virtually as common as aging itself. Recent scientific breakthroughs show the possibility to address biological aspects of aging with the prospect of preventing or curing a wide range of chronic illnesses. Scientists have discovered a collection of biological processes that decrease with age that fit three criteria. Loss in function is detected during natural aging, induction or acceleration of the process speeds up the aging process, and removal or dampening of the process slows the aging process. Age-related deterioration happens at all levels of biological function, including how genetic information is stored, read, and translated into the biological stuff that keeps our bodies healthy. Damage to genetic material is widely regarded as a fundamental contributor in the aging process, and changes in how the information in our genetic code is read and processed can also contribute to the aging process. The discipline connected with this phenomena, epigenetics, involves alterations that modify the way our DNA functions. Because of their potential to modulate metabolism, the biological systems involved in reacting to nutrition availability may play an important role in aging. The process of breaking down the nutrients we ingest to generate energy for immediate use or storage, as well as those that use energy to construct essential complex molecules out of simple building blocks, is referred to as cellular metabolism. Instead of treating each illness as a separate ailment, scientists have recommended addressing the aging process itself to postpone the emergence of many diseases. Caloric restriction, CR, is the most well-established technique for extending longevity in a range of model species and promoting metabolic health in humans. Other forms of dietary intervention, collectively known as dietary restriction, DER, are also being studied in order to determine the best macronutrient composition and feeding regimen for extending health. Metformin, a widely used and successful diabetic treatment, has been investigated in the context of aging and age-related illness, and chemicals that promote the action of sirtuins, proteins that preserve a young epigenetic state, are potentially possible therapeutic targets. In the most recent edition of the International Classification of Diseases, ICD, the World Health Organization, WHO, added old age as a general symptom and aging-related disease as an extension code. This has rekindled interest in identifying the benefits and drawbacks of legally classifying old age as a sickness. Proponents of defining aging as a disease claim that doing so will improve the well-being of older persons while also providing economic and healthcare advantages to stakeholders. Experts in geroscience, geriatric medicine, and social gerontology, on the other hand, have claimed that the inclusion of aging as a disease in ICD-11 is detrimental and deleterious from clinical, research, and humanitarian perspectives. Experts stated in a global call to action that ICD-11's classification of aging as a disease is detrimental and deleterious from clinical, research, and humanitarian perspectives. The wide range of aging manifestations demonstrates the potential for prevention and intervention, but a fatalistic generalization of all older adults under a disease classification ignores this variability and may lead to ageism, reduced efforts to prevent and treat morbidity in older adults, and a lack of attention to social determinants of health affecting the older population. Supporting scientific research to enable the creation and translation of new technologies, for example, has the potential to enhance the health of older persons without the need to categorize aging as a disease. Supporting scientific research to enable the creation and translation of new technologies, for example, has the potential to enhance the health of older persons without the need to categorize aging as a disease. The article, A Regulatory Pathway for Medicines That Target Aging, discussed the scientific and financial state of promising gerotherapeutic and preventative treatments, as well as prospective regulatory approval processes. The paper questioned the need to designate aging as a sickness, claiming that it is conceivable to approve treatments that target the aging process, but that the development of reliable, widely recognized means of measuring the aging process is required. The Predictive Biomarkers Initiative, sponsored by the National Institute on Aging, brings together researchers from several universities to discover and evaluate aging biomarkers. This effort includes finding new biomarkers of aging processes, creating methods for non-invasive sample detection and processing, and assessing how biomarkers correlate with physical indications of aging. DNA methylation, an epigenetic process, has recently gained attention as a biomarker of biological age. Epigenetic clocks, algorithms that estimate biological age based on the quantity and location of DNA changes, are a powerful predictor of both longevity and age-related comorbidities. Assays to detect disturbed cells that have stopped multiplying in blood or tissue are scheduled to enter clinical trials soon. Biomarkers that measure DNA damage or repair capability are also being investigated, although their reliability and wide application are uncertain. The Targeting Aging with Metformin (TAME) experiment is a 6-year clinical research in the United States, aiming to evaluate the effect of metformin on age-related comorbidities in older persons, ages 65-79. It seeks to analyze nearly 3,000 participants at 14 institutions across the United States, and it is the first FDA-approved clinical study in the United States to test the efficacy of metformin on age-related comorbidities in older individuals ages 65-79. The time to beginning of any significant illness, such as myocardial infarction, stroke, congestive heart failure, malignancy, moderate cognitive impairment/dementia, or death, is the primary endpoint. The TAME study is a key first step toward gerotherapeutic adoption, paving the way for more clinical trials assessing present and future gerotherapeutics with encouraging outcomes in animal models. The FDA must be persuaded before such preventative medicines may be tested. The most important details in this text are that biomarkers are highly reliable predictors of future health and longevity, that clinical trials would have to show that geroprotective therapies provide clinically meaningful benefits for patients, and that they are safe enough to be administered to a healthy population on a large scale. Furthermore, it is critical to include older people in clinical trials, evaluating new medicines, as well as to evaluate preclinical aging interventions in aged animal models. Furthermore, the current lack of agreement on how to define the context of use for geroscience-guided medicines complicates the regulatory picture even further. Companies focused on creating gerotherapeutics have recently received a lot of attention, with huge technology and venture capital companies enthused about investing in the potential to extend human life. The success shown in academic, government, and technological activities implies that designating aging as a disease may not be essential for science and society to emphasize healthy aging. Addressing the primary remaining challenges described above will position society for a new age of aging treatment. Recent advances in geroscience research imply that the molecular mechanisms underlying aging may be more malleable, potentially allowing a paradigm change from disease care to widespread prevention of numerous ailments. There is a growing incentive to develop treatments and monitoring techniques that can properly assess and treat the hallmarks of aging, but without key scientific evidence to clinically define biological aging, measure its progress and effects, and produce an appropriate indication for geroscientific treatments. Regulatory approval ensuring product safety and efficacy will remain an impediment. The development of gerotherapeutics that may be delivered throughout the lifespan will necessitate a thorough examination of biomarkers for the aging process, as well as acceptance of these biomarkers by scientific groups and the FDA.